Hi doctors, welcome. Today's video is for learning about the restoration with composite about the class 2. So this is our prep for today that we're gonna restore. Knowing about these restorations, we need to understand that we have different ways or different devices to restore it, okay? We can speak about rings, that they are matrix systems with rings, okay, that are gonna use a band, these metal bands that we can place in the space of the class 2 area, okay, that we're gonna see in a moment. Also we have the common TOEFL major, that's another option. There are not preformed matrices, okay. Instead of TOEFL major, we got another devices, kind of these ones that come with a gum that we can press and use it as a TOEFL major. But today's video is to check it with this matrix system, this ring matrix system, that is going to help us a lot in the way we perform this restoration, okay. So starting for this restoration, it's very important that we check the passing of the metal matrix, okay, and that we confirm that the metal is in the inside of the rubber dam and the gum. So we shouldn't see any space between the metal and the tooth. Can you see it there? We don't have any space, so we don't have rubber dam between the metal and the gingival floor. So once we confirm that part, that the matrix is well placed and is touching the wall of the tooth that we're gonna restore, we're gonna place a wedge, okay? But when we place the wedge, it's really important that in the moment we're gonna place it up, we, with our finger, we press down, we press the matrix metal band, so we avoid the matrix go occlusally or get out from the place that we placed it before, okay? So with the finger, I'm gonna keep it down and then pass the wedge down there, okay? Here's the first step, very important, and we need to confirm that we don't have any space between the metal and the tooth. Once we finish this part and we confirm that the floor, we don't have any space between metal and the system, I'm going to turn it a little bit so you can see it easily. Can you see there? We don't have any space. Okay, now we need to seal the sides. Here's where the rings works, okay? In this case, I'm going to show you two different kinds of rings. This is one ring that have flat surfaces, and this ring that we're gonna use right now is a ring that have a cut in the gingival area that respect the space of the wedge. For me, these rings with this space for the wedge are better for beginning with these techniques, okay? So in the moment we're gonna place it, we need to confirm also that we respect the space of the wedge. For me, it's better in this moment to go from this side, pressing to the opposite side, so it's very important to open it, go from here and press against the opposite side, so the system is gonna help us to now cover these sides for the restoration, okay? As you can see, we need to contour a little bit the external part. By this point, we'll replace the ring, pressing the other two sides, the proximal walls for the Next, restoration, as you can see here. Now we don't have any space. In this side, neither the floor. Okay, so once we can confirm visually and in place touching it with Explorer that we don't have any space, now we can start contouring a little bit the band. Why we need to contour it, doctors? Because down here, the most gingival part, we need it as near as possible to this tooth, so we can confirm a gingival seal without any overfill. Okay, but in the middle part of this matrix, we need to confirm the contact to the opposite tooth. So a little bit upper from the gingival floor, I'm gonna press with a burnisher, press the opposite side so we can confirm that contact, and then the superior part, the more occlusal section, we can leave it inside, we can contour it inside, or we can leave it straight, and later with an instrument we're gonna give that roundiness. But it's very important that we confirm that we're touching the adjacent tooth, burnishing that middle part. Okay, so by this point we can start all the bonding procedure in real patients. In the case of these typodonts, we're gonna place only bonding that is gonna help us to fill any minimal space between the system and the tooth. Okay, so right now we're gonna place some composite, some bonding, sorry, this part. Okay. We're gonna place some air so we can dismiss the excess and evaporate that agent that the bonding has. We're gonna light cure it. So as you can see, any little space between the metal matrix and the tooth is gonna start filling it up with the bonding a little bit. And now we're gonna place the composite. So as we were saying, as a technique that we saw in the class 3, we're gonna perform a shell technique today. So for this technique, I'm gonna place some material down there and package it really well. I need to ensure that we don't have any bubble or space down there. Okay, and I'm gonna start performing that shell. Okay, so don't forget that the first step is always fill up the bottom. Okay, the second now is to rise that shell. Okay, so at this point I can contour a little bit with the spatula, move excess if we need it, and I'm gonna make a little roundiness in the outside area. If we got an excess, later we're gonna remove it. Okay, so don't bother a lot. We got an excess, but as possible we're gonna eliminate it, and we're gonna give that also that anatomical depression in the center, this wall, always taking the composite to the tooth so we can avoid defects in the margin. A little bit. Now better weigh the shell, and now we're gonna lacquer it. As we practice in the class 3, at this point we can remove the system in way so we can check the contact and that we like the shell. If by any situation we don't like the shell, we can dismiss it and we can start again. But as you can see, now we have that shell, okay, that we need to remove some excess, but it's fine. Okay, some little excess also over here. But the more important part right now is that we confirm that we have a good shell without any overfill. Okay, in the side I'm gonna try to turn it so we can check it out. Okay, it's a little excess in this side that we can handle it with a blade, but it's not compromising the gingival area, so we like it. We can work it with this shell. For the last check, we're gonna check a little bit the contact. Excellent contact. So this is more important. Okay, remember the margins, we can work them, but an open contact, we need to repeat it. Okay, now that we have this section of the video, this shell of the class 2, and we like it, we can start filling up the anatomy. Okay, speaking about anatomy, we can start making different techniques, that is performing cuspid by cuspid. In this case I'm going to start performing it in that way. As always, it's very important to varnish or press the composite against the cuspids so we can avoid excess material and we can give that realistic 3D aspect. Okay, also we can mark the closal part. So we're gonna fill it up cuspid by cuspid to respect the contraction and also getting always the idea of the different cuspids and be able to perform the anatomy. Okay. It's easier sometimes to fill all the restoration with one layer of composite, but if we do that technique, we compromise the longevity of the restoration and we can overfill really easily. As you can see, right now I'm applying some composite layer. I'm using a Westcott, this instrument that I like for the fossa, so we can give that 3D fossa effect. Don't forget to varnish also the composite to the cuspid so we can avoid excess in the margins. At this point we can give some more anatomy details. Moving axis as we can. Try not to over touch the composite to avoid staining it. Okay. As you can see, I need to burnish composite over there so we can confirm that cuspid, individual cuspid. Remember, all the anatomy we give it in the casting moment, okay? Not with balls, not in the posterior moment, just in the moment of the cast. In the way you practice, you're gonna have more abilities to perform microanatomy. Depending also on your techniques, you can use sometimes flowable if you see any space between the margin and everything, so we can seal it a little bit. Try not to lose the anatomy, because if we use too much flowable, we're gonna lose anatomy. Okay, so there we're having the initial part of the anatomy. We can confirm that we don't have any space. We have some roughness, but that's great because we haven't polished yet. But we don't have any margin problem issue in here. As you can see, the anatomy is given but doesn't perform a retention to my explorer because only round the end will perform, okay? If we identify something that it may be retentive, we may play some flowable maybe, okay? So by this point, we're gonna start finishing the restoration, okay? So as we practiced the other time, remember we have several techniques. In this case, we're gonna start a little bit with the contact of the class 2, well, with the area of the contact, avoiding in any moment to touch the contact, okay? Remember, we need to dismiss the excess in the size of the margins, but try not to touch the contact, okay? So I'm gonna use disc, we grind. If I angulate it well, I'm not gonna open the contact area. I'm only gonna clean that area, always in a good angulation, okay? Well, we're gonna pass to the medium and the light disc, depending on each system. Take care not to opening the contact, okay? Perfect. At this point, I'm gonna use a 12 blade, surgical blade, to remove the excess, the little excess that we saw in the proximal lingual area. Okay. Remember, always the blade going up, trying not to touch the gum. And later, we're gonna smooth it even more with the strips, okay? So remember, before polishing, it's really important to pause the finishing bore in the margins so we can confirm we don't have any retention. If you identify a excess margin, we can touch it with this finishing board so we can then polish it after without having any trouble. Try not to damage the anatomy we perform. Only cleaning the margins. And now we can start with the polisher system. Okay, we can use the disc, the twisty EV, not to stay it in one place too much time, or we're gonna burn it, or we can even remove some part of the anatomy. Okay, we can use the one that are in a cup shape to get inside a little bit of the anatomy. At this point, if you identify any margin that is not well smoothed or finished before, at this point you can retake the finishing board, work it, and then polish it again. You're gonna notice it because the margin is gonna stain white. And you're gonna see the line through the margin. This silicone brush is going to help us to bright the restoration. And also we can use the goat brush, so we can generate even a better variety restoration. Okay. We can see we had that anatomy, that lobules. Okay. At this point, still we can check with Explorer and we don't have any retention in any margin that we like for restoration. Okay, we don't have any retention, good anatomy. Okay, we're gonna check the side a little bit. You can see that retention disappeared. With the blade, you can pass the strip to confirm the smoothness, and we're gonna check. Really good contact, a good click over there. Excellent. Okay, doctor, so let's go to practice, let's go to work, and any questions, see you in the lab.